For the past 3 days, little Ayub has been battling a high fever and has been vomiting. His mother Rahma recognises the symptoms all too well. His siblings suffered the same way last year. Here in northern Somalia, malaria remains a threat to children's health.
I know it's malaria because last year, when he became sick like this, the doctor tested and found out it was malaria. I was given medicine at the clinic and his fever went down and he recovered, so he has taken the same kind of symptoms this time too.
A team registering families for mosquito nets here in Puntland saw 3-year-old Ayub when they came to his mother's house. They immediately told her to take him to the clinic for proper testing and medication. Malaria is still common in Somalia, particularly in the south, with over 600,000 people affected in 2014. Children under 15 are often the victims. To prevent the disease, which is transmitted by a mosquito bite, UNICEF, with generous support from the Global Fund, is distributing over 1.4 million long-lasting mosquito nets treated with insecticide. Here in Bosaso town, the teams registering families are accompanied by a social mobiliser. She emphasises the importance of using treated mosquito nets properly, particularly for children and pregnant women.
What we are doing here is to register families before the actual distribution of mosquito nets. It is important we get the number of the household because without this register, it is hard to do the distribution. This is one of the most vulnerable villages in Bosaso, with many cases of malaria. Therefore, we are educating community about malaria and giving them instructions on how to use treated nets.
In a ceremony organised by the Health Ministry to publicise the distribution of 100,000 mosquito nets in Bosaso, Puntland's Deputy Health Minister, Amina Mohammed, points out other ways to prevent the spread of malaria.
The Ministry of Health is always ready to prevent diseases. Treatment takes time and may be difficult. For example, malaria is dangerous and can kill between 3 to 7 days, so prevention is better than cure. My advice to the community is to reduce the water stagnation areas where mosquito can breed. The nets may prevent malaria, but there are other effective ways to control malaria.
Hawa has 4 children who have suffered malaria twice this year. She believes the nets will make a major difference to their health.
Mosquito nets are great. They have been distributed at a good time because during the rainy season, there are many mosquitoes and even flies. I'm happy and thankful to everyone who contributed these nets.
UNICEF is one of the largest buyers of mosquito nets in the world, but getting them to the families in need is a huge logistical operation. This time, UNICEF has procured 1.4 million nets to be distributed to Somali areas affected by malaria. Of these, 550,000 have already reached Somalia. 850,000 more are in transit in Kenya, being stored in a warehouse, waiting to be transported to their final destinations.
These nets that have arrived in Mombasa have to go through different channels. They can go through the ocean up to Somalia. Then they come down by road for those distributions that are being done in the central Somalia. Some of them have to go by road through Kenya, upwards into Ethiopia and down into Somalia.
Over a quarter of Somali households now own at least one mosquito net. The number of malaria cases in Somalia has fallen by nearly 3/4 in the past 7 years. The net distribution programme aims to achieve universal coverage by 2017, with over 3 million nets in malaria-affected areas of Somalia. While malaria is both preventable and treatable, where children's lives are involved, prevention is always better than cure. This is Susanna Price reporting for UNICEF. For more information, go to www.unicef.org. Unite for Children.